Hello everyone, I am Dr. Puneet Dikshit, and after such a long time I am here in front of you, and this time I will discuss about stroke. Now this is going to be a series on stroke. Why discussion on stroke? Because stroke is a chronic disease. Means cold is a risk factor for stroke, and as it is December, so we are seeing lots and lots of patients of stroke in our OPD. Comes to us with a complaint of weakness of one half of the body, or slurring of speech, or field defect. They are not able to see one side of one of the side. So before discussing this topic, firstly I want to tell you that stroke is of two type. One is blockage type, which is more common. It is because of blockage of artery of the brain. And the second type is leakage type. Leakage means rupture of blood vessels in the brain. So blockage type, also known as ischemic CVA, and leakage type, also known as brain hemorrhage. And both of them are common in cold. Hemorrhages patient, actually most of the patient when they come to us, they are hypertensive patients, and they take shower in the morning, and while doing puja in their puja room, they suddenly develop weakness. So as it is a chronic disease, so we are seeing lots and lots of patients in cold who are not properly take care of themselves. Okay. So in this session, firstly we discuss about blockage type, which is more common. More than 80% of patient with hemiparalysis or ataxia or walking difficulty, they are because of blockage to the artery of the brain. Now firstly you should know that the blood vessels which carry blood to the brain, it has inner coating of endothelium. This endothelium has a property that it inhibit coagulation, so it prevent formation of thrombus. So if there is any endothelial dysfunction, it will lead to formation of clot and hampering of blood flow to certain area of brain and damage to that area of brain. Now one thing we must remember that the usual normal blood flow to the brain is 55 ml per 100 gram per minute. This much amount is required, but when it drop to the level of 18 ml per 100 gram per minute, then electrical failure happen. Means brain is not able to send impulse to one side of body, and body get weakened. And when it drop further to less than 8 ml per 100 gram per minute, then membrane failure happen, means permanent damage. So electrical failure, even although there is weakness, but if you thrombolize that patient, you can save ischemic penumbra, means area of misery perfusion. So area of misery perfusion, that is we called in our terms penumbra, that you can save if you thrombolize this patient in time. So the attention of the treatment is to salvage this penumbric region, which will get damaged if you are not doing anything in time. Okay. Now what are the risk factor, various risk factor? So risk factor, as already take a lecture, but in brief you should know that risk factor is divided into modifiable and non-modifiable. Modifiable risk factor, they may be behavioral or non-behavioral. Behavioral risk factor such as smoking, alcohol, sedentary lifestyle. All this smoking is a leading cause of carotid atherosclerosis, means it lead to the atherosclerosis or atheroma formation in the carotid artery, the major vessels to the brain. and it also lead to the vasospasm and formation of thrombus. Okay. The next thing is alcohol. Alcohol, if you take alcohol regularly in heavy amount, it lead to uh, cardioembolic stroke due to formation of DCMP. It also lead to the hemorrhagic stroke. Okay, so alcohol, daily consumption of high amount of alcohol is again harmful. Then sedentary lifestyle, it also lead to the enhanced atherosclerosis and lead to the formation of plaque. Okay, so these are behavioral side effect, behavioral risk factor. Then non-behavioral modifiable risk factor, hypertension and diabetes. These two are major. So diabetes and hypertension, they both lead to enhanced atherosclerosis, while diabetes also lead to rheological abnormalities in blood. So increased clogging is there and lead to thrombus formation. Other causes are high value of LDL cholesterol. LDL cholesterol, it again lead to formation of atheromas and lead to blockage of blood vessels. And then again in some blood abnormalities like increased fibrinogen level, increased homocysteine level, they also lead to formation of enhanced atherosclerosis and formation of clot in the blood vessels. Then non-behavioral causes, non-modifiable causes. Non-modifiable causes में age, as age advances, chance of thrombosis increases, and male person also prone for ischemic stroke, while stroke is more severe in female. So it is common in male, but it is severe in female. Now family history, if your parents have stroke, so you are obviously at higher risk for stroke. Okay, so these are the various risk factor for stroke. I think this is much for today's discussion.